Good afternoon, one and all. I profusely thank Dr. G. Vijayakumar sir for giving yet another opportunity in this August audience. I'm standing between you and the food. I'm not saying it as a lunch, it is food. So if I'm delaying my talk, you will get agitated. The human or any organism, any animal, whatever it is, what is the living organism in the world, have two basic needs. One is food and second one is sex. When it is deprived from you, you will get agitated. Can you make out any difference in the elephant? A single elephant, agitated, fierce. Now it will be very clear why it is agitated. When food is deprived, we will get agitated. When sex is deprived, animals will get agitated. Particularly, elephant will go on rampage to destroy everything in front of it. Because of civilization and social inhibitions, the human beings are not doing that much. But the intimacy zone, we don't know what is happening. The intimacy zone between the husband and wife, we don't know what is happening, happening inside the bedroom. So many wars are happening. So we are going to talk about advice and treatment of erectile dysfunction. The erectile dysfunction is very, very important because it can end up, one side it can end up with endothelial dysfunction when maybe cardiovascular or diabetes can happen. Other side, it can happen with, it can cause emotional dysfunction. So usually there's AD, ED and ED. So previously, we were discussing about many things. Now, I'm dividing my management into two. One is non-pharmacological treatment and is pharmacological treatment. Non-pharmacological, weight loss in obese men. Obese men psychologically feel the lower abdominal fat, they feel that penis is small, that is buried inside actually. When you are giving weight reduction, one thing, physically they are becoming very active, the weight is reduced and so many parameters will come down, the performance will increase. At the same time that a small size penis, the worry will go off. Increased physical activity definitely has an important role, but you have to educate the patient, only physical activity will not reduce your weight. You have to combine with a low carbohydrate, balanced diet. And cessation of smoking and alcohol also carries very, very important role. Here I want to mention one more thing, Kegel's exercise, KGL. Kegel's exercise, you know very well. The holding the anus and up alone, you have to keep it for 10 seconds, on hold, then release it, then repeat it for 10 times. That is one set. You can do 2 to 3 sets. The same thing, you have to hold the urethra. As like you are controlling your urine, you have to hold it for 10 seconds. The cycle repeats. This can be done by both men and female. That is very, very important because examination, without examination of perineum, we cannot conclude the clinical examination. Like that, without giving exercise to the perineal area, we cannot get good results. So coming to pharmacological treatment, there was a period when people were searching for a good drug for cardiovascular disease, for myocardial infarction to increase the coronary blood flow. The research was going on. They were given phosphodiesterase tablets. Whether they got coronary flow increased or not, but they had a pleasant side effect in the morning, they got erection. So accidentally they identified, invented this PD, phosphodiesterase inhibitor. You know this mechanism very well. Our people used to say, Doctor, you matra kuduthinga, matra pottu parthen, onnume agalana. So simply sitting will not help you. So they should have some stimulation to get the erection. So educate the patient while prescribing phosphodiesterase inhibitor. The sexual activity only will give erection. So this is the mechanism action you know very well, cyclic GMP mediated. The drugs are available, so many drugs are available in the market. In India, we are mostly using sildenafil and talidalafil. Maybe endocrinologists may add another vardenafil available or not. In my practice, I am using sildenafil and talidalafil. So this is a treatment algorithm. Oral phosphodiesterase inhibitor. Second line vacuum constrictive device. This device has to be applied to the base of the penis. After the application of the device, like holding our hand for IV injection, the arterial flow will be maintained, but the venous return will be reduced. So there will be accumulation of blood in the penis, so they can have a good sex. And sexual therapy, we have to sit with the patient and counsel them. We have to talk with them. What is happening? What is happening inside the room? Is the foreplay is good? Actually, I had a patient, the husband complained, Doctor, whenever I'm having sex, my wife is watching WhatsApp. Really? So many peculiar things are happening. You won't believe. And the sexual therapy is very, very important. You have to sit with the patient for at least for half an hour to evaluate what is happening. And intraurethral alprostatil and intracavernous self-injection, those are things of past. And third line, surgical prosthesis. Surgical prosthesis, two types are available. One is cylindrical, one is plate type. That plate type has to be inserted inside implanted inside the penis. That can be foldable, unfoldable. When you want to have sex, then unfold, have sex. Then cylinder, the process has to be set inside, then it has to be inflated before sex, then can be deflated. These are the things of surgical process. Gene therapy and stem cell therapy we'll discuss later. These are all the drugs. So for sildenafil, we can start with 25 milligram, 50 milligram, 100 milligram. We can go up to 200 milligram, but the side effects will limit the usage. Usually, when comparing sildenafil and tadalafil, sildenafil will cause more side effects. Flushing, palpitation, gastric irritation, nasal stuffiness, all those things will be there. Whereas tadalafil will be a little bit milder. It will almost look like a normal erection. Tadalafil dose is starting from 5 milligram, then 10 milligram, then 20 milligram. Most of the time, the people with erectile dysfunction will be having premature ejaculation also. So we have to start with low dose, then we have to go further. If it is not working, we can add a 15 milligram of dapaxetine and then 30 milligram. Standard tablets coming with 20 milligram of tadalafil and 30 milligram of dapaxetine. So let us start with half a dose, 10 milligram plus 15 milligram, that will work. Some people, I used to advise them, take 10 minutes before food. So empty stomach, the absorption will be more. But after food, absorption will little bit reduced, the effect is little bit reduced. Even those non-responders, if you advise them to take in the evening, 6 o'clock, it is more effective. And sildenafil side, you have to, I used to take a ECG, your heart is good, so while getting palpitation, don't be panic. So we have to explain all the side effects though, so that during the time of sex, they will feel already thing is there, they may get heart attack or something else. So we have to give the courage to have it. Tadalafil can give rise to back pain if they are taken continuously. Because we are having phosphodiesterase 5 enzyme is there, 6 is there and 11 is there. When 6 is more occupied, stimulated, then there will be visual disturbances, blood vision, all those things will be there. When 11 is stimulated, acted, we will be having backache. So we have to educate the patient. Whatever side effect, if you are educating them, they will be ready to face it. End of the day, they need to satisfy their wife. So sildenafil can go up to 200 milligram, but the discontinuation rate is very high because of side effects. Tadalafil, I am dividing this usage of tadalafil into two. One is for elderly people, they can take whenever they need, so on demand. For those people who are newly married, going for planning for a child, they have to take alternative days because they don't know where they are going, when they are going to have sex. That is a big thing. And already our endocrinologist discussed about this one. Penile artery size is 1 to 2 millimeter, coronary artery is a little bit higher. So when you are having a problem with penile artery, definitely you are going to have a problem in coronary artery later. So sexual activity in cardiac patients. If your cardiologist advised you, you can have a moderate physical activity, then you are free to have a normal sexual activity. There is very less chances of having a cardiac event during sex. And there is a Princeton 3 consensus recommendations. They are having two objectives. One is cardiovascular risk, but no CV disease in patients with ED. And they are going to evaluate on cardiac risk associated with sexual activity. They are having 3 classes. One is low risk. There are all the parameters, myocardial infarction, more than 6 weeks old. And I have one revascularization procedure, controlled hypertension. If only less than 3 or more risk factors or less than 3 factors are there, you are coming under low risk. More than 3 and moderate stable angina, my MI between 2 to 6 weeks, and I had class 2 means you are coming under moderate, and you are having unstable angina, and I had 3 and 4, you are coming under high risk. If you are falling in low risk, you can have sex. If you are having high risk, sex is contraindicated. If you are coming under intermediate or moderate risk, wait for some time, reassess yourself. You are coming under low risk, proceed. In high risk, stop. That's it. So what happens in diabetic patients? So almost most of the people what we are seeing diabetic patients, they will be having erectile dysfunction. One of the old men, 56 vayasu orthar vandaru, sir, I'm having மைல்டு எரெக்ஷல் டிஸ்ஃபங்க்ஷன். எதிரில் ஒய்ஃப் உட்காந்துருந்தாங்க, சார் ஒன்றும் இல்லை. ஸோ you are facing patients and we need to control the diabetes. In diabetic, a 35-year-old diabetic man is equal to a 60-year-old non-diabetic. If you have diabetes, your sexual age is more. Hyperglycemia control and reversibility of ED, the long-standing diabetes, gradually the things are happening. But in transient hyperglycemia, say for example, the patient was having good glycemic control, and all of a sudden, last 2 to 3 weeks having high sugar of 400 or 500. By reversing this transient hyperglycemia, that can be reverse erectile dysfunction. And talked about the drugs. There will be on polypharmacy, diabetic drug, hypertensive drugs, all those drugs. In hypertension, I prefer nebivolol because I NO donor. It won't cause any problem. So young hypertensives with the diabetes ED, we can go for nebivolol. Another documented evidence, sildenafil citrate in diabetes, they can very freely take. Type 1 diabetes, they can take. And extreme duration type 1 diabetes also, it's very safe. It increases the maintains the brachial artery flow mediated duration, and phosphodiesterase inhibition improves the beta cell function in metabolic syndrome. That's an important thing. I'm skipping few slides for want of time. It is a case of 55-year-old male, gradual worsening of erectile dysfunction, diabetes parameters under control. Here it is supported by this article, Cochrane evidence. They can go with sildenafil without much problem. The basic side effects will be there where they can tolerate, which they can tolerate. In case of congestive cardiac failure, but want to have a sexually active life, here the conclusion is sildenafil improves the cardiac performance because of a decrease in LV load, which is caused by decrease in peripheral resistance in aortic and large artery stiffness. The alpha blocker, already it was discussed. So low testosterone associated with obesity and metabolic syndrome, which contribute to sexual dysfunction and cardiovascular disease risk, man with type 2 diabetes. Testosterone replacement therapy is ineffective in eugonadal male, and in hypogonadal male it is successful. The formulation, these are the formulations available, oral, intramuscular, topical, and the benefits of optimal testosterone. The gene therapy, they are focusing on the nitric oxide synthase, ENOs and NNOs. By increasing that, they can have them vasodilatation and further improvement. And stem cell therapy also aiming at improving the revascularization, all those things. And special situation thyroid, we can use. Parkinson disease, we can use. There is an important treatment called low intensity extracorporeal shockwave therapy for diabetic men with erectile dysfunction. Usually when you start treatment for erectile dysfunction, we start with low doses, we go to high doses. Even with high doses, there will be non-responders. After some time, they won't respond to the sildenafil citrate. After this low intensity shockwave therapy, definitely there is improvement in the non-responder. They will start to respond. In animal models, it has showed great improvement. The non-responder turning into responders. So early identification and treatment of erectile dysfunction will improve mood, quality of life, cholesterol levels, and exert some cardiovascular protection. Phosphodiesterase inhibitor, commonly used to treat erectile dysfunction, require good testosterone availability for effective action. The small video. Can you play it? Audio is not needed. Visual itself is understood. Okay. Whatever they do, females are forgiven, males are not forgiven. So help your male patient to maintain his integrity and good life. Thank you so much.